Hey everybody, welcome back and welcome to my channel to all you new timers. This is your girl Midas Touch Baby, and let's talk about what's going on in the state of New York. New York State ends the essential plan for 450,000 people. This is going to affect so many people. For some, 450,000 New Yorkers enrolled in the state's essential plan stand to lose that health coverage next year under the fallback plan by the state in response to federal cuts. What federal cuts are you talking about, Midas Touch Baby? The big, beautiful bill that so many people were saying that they want to pass. It passed, and let's see how this is going to affect you. State officials announced the changes on September 10th after weighing how to deal with the impact of those cuts on an insurance program used by 1.7 million low-paid workers in New York State alone. Their recourse was to shrink the eligibility as of next year July, which will disqualify those who enrolled through a program expansion last year. This is very disturbing and heartbreaking to hear. The new approach, which requires federal approval, averts that fiscal plan, but it also forces New York to undo last year's expansion of the essential plan, restoring the low income cutoff it used to have and rendering ineligible those who signed up after the limit was raised. Oh my God. Do you know how many people that's going to hurt in the communities? Do you know what communities that affect? The poor areas, parts of Brooklyn, Queens, Bronx, Manhattan, upstate New York counties as well. In a statement, Governor Kathy Hochul said that the unwanted step was the best way for New York to save the essential plan for its 1.3 million remaining enrollees. In the face of federal cuts enacted in July, she chastised Republicans for making those changes and urged them to delay the implementation for 3 years to cushion the blow. Oh my God. Let me tell you something. Many of the 1.7 million people of the Essential Plan are working part-time, including at big retailers and other companies that deliberately limit hours to avoid covering health care. What? You corporations and retailers who are making money are purposely putting people in harm's way. To hell with you. It's time for these employers to stop passing the cost on to taxpayers and start providing coverage for their workers. Did you guys know here in New York Presbyterian Hospital is no longer accepting Health First unless you go through the emergency room. But you cannot use Health First as your main insurance for their doctors. Look it up. Yes. So this essential plan is really going to hurt a lot of people. And I know a lot of you saying, what is New York's essential plan? The essential plan is a federally funded state-run program that New York created in 2015 to cover low-income workers who earn too much to qualify for Medicaid but don't get enough insurance at their jobs. It offers comprehensive care with no premiums and some copays. New York got federal approval last year to raise the income limit to enrollers to 250% of the federal poverty line, which makes the current cutoff about $39,000 for an individual and $67,000 for a family of three. Undoing those changes restores the original limit of 200% poverty level. Oh my God. It doesn't affect me, but you know what? Anything in life can happen. And it's just really sad to hear that this could happen to somebody. Oh my God. Statewide, roughly 450,000 enrollees who earn more will be disqualified as of next year, July 1st, when the state plans to make that change. Do you know You know, sometimes when something so bad happens, you just lose what to say. But I'm going to say it this way. For those who live in Monroe County, 15,960 will lose their insurance. For Orange County, 8,094 will lose their insurance. For Rockland County, 7,544 will lose their insurance. For Dutchess County, 5,198 will lose their insurance. For Broome County, 3,789 will lose their insurance. For Ulster County, 3,724 will lose their insurance. If approved by the federal government, is that the income cutoff for the program would drop next July and force many to buy their own health coverage on top of paying for your food, on top of just your bare essentials, on top of getting clothes and taking care of your children, on top of just getting back and forth to work, whether you have to pay for an Omni card or whether or not you have to get gas or whether or not you just have to walk everywhere. You know, it's not right on what the government is doing to the people. And when I mean the people, I'm talking about you. I'm talking about myself. I'm talking about all the other ones who's listening to this channel. I'm talking about us. What are we going to get out of this? It seems like they're crushing us all down to the ground. All for a bill that you want to block some people and make sure that they are level to the ground and have nothing, so the richer will be rich and the poor will be poorer. This is your girl Minus Touch Baby. Follow me on one of these other platforms. Until next time.